this bill third reading.
I call on Government Order of the Day number 3.
Health Practitioners Replacement of Statutory References to Medical Practitioners Bill interrupted debate on second reading.
Porter Williams.
Thank you, Mr Speaker. It gives me pleasure to rise and take a call on the health practitioners. Excuse me, I'll make sure I get this right. Replacement of statutory references to medical practitioners bill. Mr Speaker, I wasn't on the select committee at the time that this bill was reported. However, I do have a little bit of industry knowledge, and I've been able to read through the report and recommendations of the committee back to the House. What this bill in effect does is it allows health practitioners, it redefines health practitioners from what we previously knew as medical practitioners, and it allows under legislation them to perform some statutory functions. And the obvious example that's quoted in the legislation is about nurses and nurse practitioners. Now, the legislation talks, it gives some clear definitions. It talks about their competencies, and when we look at the way the health workforce has developed over the last 15 or 20 years or so, with technology, with advances in medicine, it's made it important for us to be able to review practice of particular health professionals to ensure that they are able to do what they're able to do, and also to remove particularly GPs from some of the statutory functions that they have usually and normally carried out. So there are a variety of responsibilities, particularly for nurse practitioners, that have been defined within this legislation. What it also does is it gives us the opportunity to develop other health professionals. There are programs to build other competencies into health professionals, and if I think back into my own experience in community mental health, it's not so long ago, Mr Speaker, that we developed programs to ensure that our mental health support workers and support staff actually had some recognised qualifications. It wasn't so long ago that many of our mental health support staff actually didn't have qualifications, and there has been a real program to ensure that those staff, that other support workers actually are well trained, well experienced, and that they are on a pathway to continuing education, and that can only be good in terms of professionalising our support staff. So as the bill was reported back from the Select Committee, some of the most significant parts of the legislation are the comprehensive definition of nurse practitioner. Now, within amendment to section 2.1, this includes their ability to hold, the definition includes ensuring that a nurse practitioner holds a practising certificate, that they're registered by the Nursing Council under the HPCA Act of 2003, and that they have the relevant scope of practice. So that's now within the legislation, a definition for health practitioners. There has been a change in definition with regards to doctors' surgeries now being called medical centres, which I guess is what most of us, when we are attending attending our GPs would go to, and there's recommended changes to the appropriate clauses to ensure that references now that previously would have been doctor surgeries are now medical centres. There are also amendments to the Mental Health Compulsory Treatment Act, which it will insert within it definitions of health practitioner, primary health care provider and nurse practitioner. Mr Speaker, it is a good bill, and it has cleared, it has ensured that nurse practitioners are recognised for the work that they do, as well as other health practitioners, and I commend the bill to the House.